of our teenage patients had one of the most aggressive tumors that were eroding his skin. His entire back was covered in this tumor. They were managing bleeding. They were managing pain control, but every single hour, 12 hours a day, this is what you're dealing with. Like, you're seeing these massive wounds. And when I compared and when we started talking about, like, you know, our nurses experiencing PTSD, when we think about wartime or deployment, when they were seeing, you know, these things, maybe not in the United States, but in other places too, like, our nurses at the bedside are also witnessing these wounds, these hemorrhages, these things like that you do see in wartime situations. And it's very different. But many times people don't talk about that these are traumatic things that we are not always preparing our nurses to enter into this workforce. We're not preparing maybe our nursing students, or during those orientations, are we trying to shelter them from the really tough families or the really traumatic end-of-life situations? What are we doing? You're dealing with the highest acuity, the sickest of the sick. You're seeing things like never before in our profession. And this world that we're dealing with is not natural. Everybody doesn't walk into the same rooms and situations that we in healthcare